Okay. Now, if people are keeping on joining, let them join. I have 14 registrations. Only Jeshiben told me she couldn't, after registering, she didn't get the link. So I forwarded the link to her, but I'm guessing you guys were able to join. So
Yes, we
that's
got
good.
the link in the email.
Good, good, good. Okay. Okay. So welcome to this free session. And today what I'm going to do is just give little tips and answer questions, let you guys know what exactly alternate healing is and what are the different modalities. And out of these modalities, what are the different modalities that I can help you with. So before we start, I want to first thank all my teachers and all the gurus that I have learned this therapy from. I really want to show my gratitude because I'm able to find good success in bringing some smile on people's face. And that helps me to continue to learn further. So if I have anything that I feel that I don't know, I'll always let you guys know that I'm still studying on that part. I am continuing my studies because there are so many different things out there to learn. So very first thing, let me ask and make this more interactive is, how many of you know different kinds of alternate healing therapies other than you come to me?
No, okay. That's the thing.
Any more other alternate healing therapies that you're aware of? When you hear alternate healing, what comes to your mind?
Therapy?
Sorry?
Therapy, you go to the therapist?
Therapist, yes, yes. But when you're talking about alternate, generally what people think is they go for massage, yes, and
that healing, like where they don't touch.
Reiki.
Reiki,
Yeah.
Yes, yes. A lot of people go for
Smells.
Reiki.
Smell therapy, like scents, smells.
Smell therapy, yes,
The
yes.
pressure points.
What is that?
You
Pressure points, yes,
Right.
yes. Actually, now that when you guys started talking and I can't hear you, meaning my Bluetooth is actually not working. 1 second, let me get my Bluetooth again. Connect. Okay, so now, okay, so pressure points, yes. And pressure point is one of the things that I do, that is acupressure, right? So there are so many different therapies like twisting therapy, massage therapy. Even in massages, there are therapeutic massages, right? If I do reflexology, there is a therapeutic reflexology. And today's world, you will find so many different ways of alternate healing. You will see people they talk about just manifestation, they talk about law of attraction, they talk about NLP, they talk about EFT, they talk about tapping. There is hundreds of alternate healing that has popping up. And it is not that something that is starting to pop up today. It has been going on, and there were so many different variations that came out. Okay, so one of the most ancient one, if we think of, is Ayurveda, right? Because Ayurveda or herbs are one of the things that people do it. Even no matter which country you go in, there is always grandma's recipes. Grandma's recipes for cold and cough, grandma's recipes for aches and pains. You know, anywhere, if you talk to anybody, not just Indians, you talk to any race, any clan, any country, you will always find them talking about different things that you can do. Yes.
What is it called again? What is it called again?
Ayurveda.
Can you spell-
Ayurveda is from India. Ayurveda is from India, but herbs, that is kitchen, from the kitchen. Grandma's recipes from the kitchen is like very popular no matter which country you go in. And why it is called grandma's kitchen? Why is it grandma's kitchen? It's not that I'm a grandma, but I may know very less than what my grandma used to know, right? I will be only passing on few things that my grandma or my mother taught me. But because it's grandma's recipes, because it's ancient, we are talking about something that has been going on and passing on down to the families, right? So here we are talking about acupressure and what I do, okay? And why I'm bringing this old therapies and why I'm talking about ancient things and why I'm talking about these herbs is because even as an acupressure therapist or anybody that you go as an alternate healing, they will have something or the other they will be talking about from ancient times. They will be talking, if you go to anyone, they'll say that, my grandma used to say this. If you do this, this is good. If you eat dates in the winter season every day, putting some purified butter in it, which is ghee, it gives you a lot of strength, right? It builds your immunity. It's very good for you. So things, little bits, tits and bits are always there. But what I am doing is different type of acupressure also. So there are two different ways of acupressure. And now there are different ways of acupressure in itself, where there are small segments that you can learn. So then as I started learning, I found out that acupressure as a traditional Chinese medicine is not exactly just Chinese, but it's also from many Asian worlds. It's pressure points. Basically, our body meridian has so many pressure points, so many meridians that we are having in our body. And they are divided into 14 meridians, 12 main meridians, 2 master meridians, which are called vessels, and they govern our whole body. Okay, so in this pressure points, I have learned there is a Greek technique. Okay, there is a Japanese technique. Now there is an Ayurvedic technique. When I say Ayurvedic, then it is all about how our ancient world because what we learn is we have 10,000 plus years old of therapies and books and um, uh, history that we can bring to the world for healing, right? So there are so many different pressure points. Now, when I talk about pressure points, many of you know, and many of you have already come to me, you have experienced with me the pressure points that I work on, and I have explained. So I'm going to explain it again. So what are different kinds of therapies that I do? Color therapy. I work with colors in many ways. I use colors for you guys. I do seed therapy, which is from the kitchen. So we take a lot of things, kidney beans, and we take black gram, and we take green lentils, and we take fenugreek seeds and black pepper. We take all these things to heal, and different ways you can treat that. And I'm going to give you those tips. Color therapy, aromatherapy. Aromatherapy is very popular, but it's very popular, especially in the Western countries, for just the aroma of it, like putting it in candles or putting it in the infuser. But what really aromatherapy is all about essential oils that can directly work into your nervous system, and it can help you feel better. Even if it wouldn't heal you completely, it will at least feel better. And there are many oils that can heal you as you can use it in a proper way. Like, I don't know, I think if I'm not mistaken, one of you, I might have given the aromatherapy oil formula to use for one thing or the other, maybe aches or pains, or maybe someone might have got it for any kind of fungus, or someone might have got it just for relaxing. Someone might have got it for just dry skin. It depends what is going on with you. And I might have created a customized formula for you. So with that, I want to ask you guys, how many of you know about Sujok therapy? Yes, yes,
You told me and I forgot, so go ahead.
that's okay. And that's why this is a class that, as I said, that this is a class, some people might feel that it is just not even helpful because you have been hearing it from me, and some people will really feel helpful because if you have questions, I can answer. So in Sujok, what we do is Su is hands and Jok is feet. So you're working on the hands and the feet. Okay. In Sujok, I have always said that you have to take this as your body. If I hold this hand like this, and now I'm taking this as a body, imagine this thumb part, this much part of your body is placed here. I wish this was flexible and someone made it flexible, but this whole part goes up here. If this goes here, then what you see here is your head. Okay, so this becomes your head. This starts becoming your neck. Then it goes down. So if you come up here, that starts to become your torso here. Then you come down, and these are the hands. So these are your hands. These are your feet. Okay, so if this is your body, and if I'm going down here, what do you think will be here?
Stomach area?
Yes, correct. You get your lungs and then you get your stomach over here, right? So if this is your lungs, then of course down as you go, this becomes your duodenum, right? And then your stomach, and then you keep going down. So,
Yeah.
so if I go here and if I say, hey, if I have pain or I have UTI or I have something going on with my lower abdomen or my organs, right? If I'm having something going on around my uterus or into my, having problems when I'm going pee, then what do? I go here because this is where our excretory area is, because these are our legs, right? These are our legs. So this is the front part. So as soon as I turn it this way, this still stays up, right? So this back side is what? Now, it's your back, your head, back of the head, right? As you keep going down, again, this front part of the shoulder, this is the back part of the shoulder, and then we are going down this way again, correct? From here, we are coming down, right? So now some people will say, hey, I'm having constipation, I have stomach problem, I get constipated a lot, or when I'm passing my stools, it's very difficult. What do? I tell them to press in the front and in the back. What do I tell them to do? Front and the back. Okay, and now here is your back. This is all your back, right? Because this is your legs, these are your hands. So this is your whole back. And where does the kidney come? The kidney comes in the back over here too.
Yeah.
Okay. Okay. So far, we learned a little bit about Sujok. What question would you have? If you have any questions into what you want to understand or what you can do it yourself to make yourself feel better. Have any questions? Then I'll jump to color therapy.
Yeah, when you do that, it's a bone here. So do you go down?
No, you go in between.
In between.
See? Yes, you're going in between. So where exactly is your excretory part? It's in between your two legs, right?
Yeah, okay, yeah.
Right? So you're going to go between the legs.
Mhm.
Okay?
And you press it, and you press it.
Yes,
Up.
you press and you
Up,
press it. Yes. If you have, no. If you have diarrhea, you go up because
Okay.
you don't want to come down, right? You want it
Mhm.
to stay. But if you're having constipation, what you do? You want it to come out,
Mhm.
right? Because it's very painful when you're passing your stool. So that is when you're
Then go
going
down.
down. Yes. Then you go down. Yeah. Then you go down. Why? Because you're pressing and you're telling your muscles to relax, to open, to go down, to loosen up. If you go up this way, you're telling your muscles to tighten. That means so you don't get your diarrhea or you are having loose motion, you want to hold it. Make sense?
Yeah, got it.
Okay. So now I'm going to
Energy.
show you, yeah,
What about energy? To get
energy,
energy.
to get more energy. Sure. So to get more energy, the best way of doing is first to do breathing exercises. Breathing exercise is very important. Why do I tell breathing? Because without oxygen, you're not going to get your energy, no matter how much you try. Okay, so you have to have oxygen. Even while we are going through this pandemic, what do doctors tell us to do? Breathe,
Breathe.
make sure your respiratory system is clean and clear, right? Make sure your lungs are stronger. So I always insist everybody, and most of you who have been coming to me, I have been giving you that breathing for last 2 minutes, 3 minutes without your mask, because I know with the mask, it's difficult. It's difficult to keep breathing with the mask on, right? Because you're not able to get that oxygen. You're getting it, but you're not getting completely. And I have shown you guys a lot of times with the oximeter also, right? That as soon as you have that oximeter without your mask, your oxygen level is going to go up. Now, what should be your oxygen level? Or if you
97,
don't, sorry,
97,
98.
98.
98 is a good number, okay? So between 93 and 98 is a good number. If you start dropping after 94, you should make sure that you're doing some breathing exercise. And after breathing exercise, if you're not feeling better, you must definitely see a doctor, okay? So now that you asked about energy, I'm going to give you some tips on that. So how do we know that we don't have oxygen level in a proper, we don't have a proper level of oxygen? Two things. One is while you're talking, after a while, you have to take a breath, right? You kind of start taking deeper breaths because you're tired, because you feel that you have to gasp for air. So then you know that there is something wrong with your lungs or your respiratory system. So then whatever you're doing, do a slow breathing. The slower you breathe in, more slower than that you breathe out. Do that slow breathing couple times. If your oxygen level comes back or you're feeling better and not tired, you're fine. Okay. A lot of times people who are just walking a little bit, you're doing your daily chores, but while you're doing your chores, you get tired just by going up and down a little bit. It's not even 5-10 minutes and you start feeling tired. You want to watch out. You want to make sure that your lungs and your heart both are functioning properly. Okay. Without an oximeter, this is the best way to understand that your oxygen level is down. Color therapy for energy. Red color. Okay. Take red color right below your little finger. You see here?
Mhm.
Here you will feel there is a groove, like there is this bone, there is this nerve, and then here is a groove.
Right.
Okay. In that groove, in that groove, you will do red color dots like this.
Let me go grab my marker. Hold on.
Sure. Okay. So you do this red color like this. Okay. So it is in the groove, right? It's in the groove. And that should help you revive your energy also.
Put your hand back up.
Sure. And you have to see that your groove is in the right place.
Right.
Because sometimes some people have a thicker, they might have a thicker bone here. So they might go a little in, but you have to find your groove. Yes.
Okay.
Yes.
And then how far? And then just below that twice?
Yes, twice. 3 dots. Okay.
Oh, in that groove, right?
Yes. One below the other. 3. Yes. Yes. So you just have to make sure that it's in your groove. Okay.
Yep, I had to adjust it.
Yes. Yes.
Because I had to put my
Yes.
hand-
Yes. When you're showing it, it will
Yeah,
turn.
it's easier
you-
to find a groove if I put my hand up, then I can find it.
Correct.
Okay, cool.
Correct.
All right, got it.
Correct. Right?
Yep.
Now, common cough and cold and throat infection. So I have told this before. I'm going to tell you again. I have posted this before also. Turn your hand, make a fist, and right in between, you're going to do this black color. You're going to use black color. And this one, that color therapy I'm showing you is for immunity. I have come close contact twice with COVID patient. And I'm knocking on their wood that I am fine, even today. Okay. And I strongly believe that this builds your immunity, keeps you away, because a black color also takes away a lot of infection from your body. So this is one. Then you take your thumb, and you measure. So if I did a point here, I take my thumb and I make a, from the point to below, that is where I will make my next. So right now I can hold it like this. Then I know where my point is, and I will make my second. Do you see this? Right? Okay, let me check if anybody has questions. I don't know if anybody is out there. Okay. Got it? Yeah.
Go?
What is that?
How far you have to go? Just one thumb?
So yes, just one thumb.
Okay.
So I just, yes. Now, after one thumb, I'm going to go from my first point. I put my index finger and I put 4 fingers like this, right? I hold it like this. So my first point is covered. Do you see? Now I'm moving my this finger and I'm holding this, and this is my third point. I holded it like this, then I slide it, right? So I know that I'm covering everything. Then I slide my little finger in the center. So I get my third point. So now this is how your okay. Just doing this has helped many of us therapists, even in India, who have been able to help the COVID patients, because we have been able to keep ourselves immune to the infection. Okay. Now, if you have any kind of infection, it can be any kind of infection other than COVID, like you can have throat infection, you feel sinus, you feel like so much pressure or irritation in the nasal area or anything. So very first thing I showed you is the hands, right? What did I say? This is our head, right? This is our head. So now if this is my head, right, where will be the nose? Where will be my nose?
Right here.
Yeah, my nose is out of the head, right? It's
Yeah.
above. So whatever is that, yes, protruding part of it, yes. So that will be the nose. So you can always do a black color on that part.
And that is for what?
Any infection in your nasal tract. So this black color is for taking away infection. Now, if you have running nose, what if your nose is constantly running? What color would you use? Yellow. Instead of the black, you will use the yellow color. Okay, so in the same area, you will use yellow. And once you use the yellow, you will surround the yellow area with a black line. So if you want to write it down, because running nose happens a lot to little kids. Okay, and this is 100% proven because my 4-year-old grandson comes with running nose more often than anybody else I know. And probably we all know that when kids are growing up, that's what happens, right? So when you put a yellow color, yellow is for stopping. It stops the running nose, and then you put a black line around it, which will stop the infection. Okay, and you can do it in both the thumbs. Now, if I am feeling that my running nose is only from this side of the nose, then I will do it on this hand. This side, this hand. This side, this hand. But I'll do the black color on both. Make sense? Yeah, because a lot of times running nose is only from one side. And then what happens is as soon as you do the yellow color, then you feel like, oh, now my nose is blocked. Now my other nose started blocking. What do I do? Now what do I do?
So you do the
Right?
opposite, right? You do on
Yes.
the opposite side.
No. So if this is your, the right side is blocked,
Yeah.
then I'm sorry, right side is running nose, then you do it on the right side, yellow color and a black line around it. Make sense? Yeah. Okay. So more about energy. Energy, this is one, breathing is one, memory,
Mental energy. Mental energy.
mental energy.
Like
Join
from
my
dep-
meditation
from,
class.
Like from depression and stuff like that. That's where I was going with that from before, to lift that.
Join the meditation class. Meditation is one of the best ways.
Meditation. You said meditation. I thought you said medication, like taking pills. I'm like, no, I'm not doing that anymore. Okay, meditation.
Meditation. Yes. Meditation.
Okay.
Yes. And meditation is one of the proven ways to calm your mind, to bring more stability and calming and coming out of a lot of your depression. It takes some time, but it's going to help you. Okay.
Yeah.
Now, the spleen is one place. Spleen is our organ that actually keeps our immunity strong. So there is another way, and what you can do is your right hand, ring finger. Okay, your right hand, ring finger, this joint. the joint. If you can get fenugreek seeds, I say seeds because that is the best way to work. If you don't have, and I'm sure we all have seeds one way or the other. You have some kind of seeds in your household. So I would think that everybody has seeds. But if you don't have fenugreek seeds, I would suggest you to buy it. If you don't have fenugreek seeds, you can take even mustard seeds. You can take anything that is more smaller in shape. Okay. And you will place it like this on the tape. Okay. And make sure you make a bigger line so you're covering the whole circumference of the finger. Here is your spleen. And you guys can try this. Put this at night. At night, do this on your right hand ring finger. Put seeds here. You will definitely see a difference in the energy. Yes.
I don't have a spleen. My spleen was taken out in one of my surgeries. Yeah, it was attached. It was actually attached to my ovary. It's a long story, but it was, yeah. So I don't have a spleen.
You can still do this therapy.
Okay.
Because another thing I want everyone to understand is a lot of things that we talk scientifically is really scientifically because we are talking about science and its organs and its functions, but also at the same time, we are going at the quantum science because there is an energy level of each organ. And that is how the energy is passed from one organ to another. So a lot of times people say, I don't have a gallbladder, I don't have a spleen, or I don't have any, yes, you know,
Uterus.
I don't have an
Uterus.
appendix. Yes, but at the same time, those energies that are attached with that organ doesn't go away because it is in that pathway. So definitely still keep using it. So you do this right ring finger, last joint. Make sure that you're covering the circumference and you will see how the energy level changes in you. A lot of times I have seen when clients are coming and they're saying that, you know, I don't know what's going on, but I don't feel good. I'm feeling very low. The first thing I do is sometimes I just put this seeds on them. And then there is another one that you can do. Again, you can take fenugreek seeds or any kind of seeds, even if you have whole wheat in the house, or if you have rice, you can take rice, you can just line it up. And right now I'm just doing it for showing you. So I'm just going to take few of them, put it in a line, and I'm just showing you where to put it. So in the same finger here on the top, and that is your stomach. So as soon as I do this too.
At the crease? At the crease?
At the crease, yes.
Okay.
Yes.
And that is for what?
This is for energy. Like when you say you feel low, or you're feeling that, you know, I don't have enough energy, or I'm getting tired too soon, then you can do this with the red color. You can help the spleen get more energy. So this is the spleen, this is the stomach. Okay. So this is again in different ways. So I'm just showing you this as a energy thing. Because before I showed you and I said the stomach is here, then you will get confused again. So I'm just talking about the way you can treat yourself. Okay.
Thank you.
Okay. So a lot of people also in the wintertime complain about dry eyes. I don't know. I get a lot of complaint that people say that I get dry eyes a lot, especially in the winter because of the wind that, you know, when you go in that cold or when it is windy, because you don't have much to cover, you're covering everything else, but not your eyes because you need to see. So a lot of times you get that eyes. So now here I already showed you, this is your nose. So where is going to be your eyes? 45 degrees from this point.
Yeah.
So you go
Little now.
up. Yeah, 45 degrees up. You do a green color. Okay. You do a green color. And if you just want to have fun, smiley face. Okay. So this is good for dry eyes, right? Now, a lot of us have acidity, and acidity brings in a lot of diseases with it. If you have throat irritation, your cough is not going away, you constantly cough, especially when you're lying down, you start coughing. So a lot of people complain about coughing at night. They cannot sleep because that coughing doesn't go away. They take everything, even if they take any kind of cough drops or cough syrup, it helps them for 3 hours, 4 hours maximum. Again, they start coughing. Again, they have to take something. This is normally is because of acid reflux, because as soon as you lie down, your acid reflux goes up towards the duodenum and it starts irritating. So you take your hand, take your ring finger and see where it stops. Okay. And that's where you will do a green dot. That's where you will do this color therapy.
Kind of like in that indentation.
Yes, but it's down below where the pillow is, pillow of this.
Okay.
Yeah. Yes.
To do
Yes.
green color?
Green. Yes. And dark green. Use dark green. Yes. Yes. Great. Okay. So I showed you seed therapy for spleen. Now, energy. Again, one more thing that I want to show for energy. Lot of times, do you know what helps to keep our body, all our system going smooth? Other than heart, with the heart, what is important? What are the other important organ that is really important for our body to keep having a good service?
Kidney?
Yes, kidneys.
Kidneys.
Yes. So now your little finger and your ring finger, you go down, find the groove here. There is a, right? There is a groove, right? A valley. Take kidney beans. The mouth of the kidney beans, which is like the white dot, should face inside the center line. It should face the center line.
Right under.
Just one
No. How many kidney do we have?
or two? Sorry.
Even if one kidney is donated, please do it on both.
Oh, it's for God's sake, I have to.
She's funny.
You need a really big kidney. You need a really big kidney bean. A big kidney bean.
Right.
Two kidneys, one big one.
Yeah, one big one, right? So that is fine.
So funny. Wow.
So only on a, you said on a right hand or on a left hand?
You should do it on both hands,
Oh,
always,
both.
always.
Okay, so it faces which way? Where
It
is
should, the mouth of the kidney,
Right.
the mouth of the kidney bean should face the center line of your hand.
Okay, should face center.
Yes. And I want to tell you one story about I recently had an expo.
Wait, how far up and down do you do it? How far up or down?
It shouldn't be up and down. It depends on where the groove ends.
Oh, so at the end of the groove. Okay.
Yes. Yes. So a lot of times you will see it is up and down. Actual kidney also in our body it's not on the same level. It is up and down.
So you mean you do at this both places,
Yes.
right?
Yes. Yes. So at the expo, I was applying kidney beans to most of them because I know kidney needs, our kidney needs more energy. In today's world, we have so much stress. We don't eat well, we don't sleep well. So in order to do that, to keep the kidney energy level at a good point, I suggest everyone to do once in a month for a whole week. You should do your kidney beans on both hands. So I told this one lady to do that. I put the kidney beans on her at the expo, and she literally came back in 10 days and she said, I don't know what that does, but I feel so much better just by putting the kidney beans. And that's why she started coming for the treatment.
How long do you have to do it?
You put it at night.
Yeah, I know.
That's it. Yeah. So for 1 week, once in a month for 1 week, once in a month for 1 week.
But you change it every day, right?
Please throw away the seeds every day and use new seeds.
New
Thank
seeds.
you. Thank you for reminding. Yes.
Yeah.
Please do not reuse the seeds. Please throw away. They lose the
Yes,
energy.
every
And the
month.
minute they are away, the minute you
Send
take it
energy
out
to
from your body, they lose their energy. They have already used the energy to heal you. So throw it away. Yes. Question. You had a question, Brandon?
No.
Okay. 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 So kidney beans. So for energy, now I told you 3 things. Tell me what?
Tell me more of them. What? Tell you one of them?
Tell all of them to me. What did you learn?
Oh, breathing. The red 3 colors.
Yes.
Meditation.
Yes.
Um,
Hello?
let's see, the right finger, the last joint, tape all around at night, like that's got to be all around it.
Yes.
And then at the crease on top, I forgot what that is. What's the one at the
Stomach.
crease? What?
Stomach. Here is the spleen and this is the stomach. It's the pair.
Okay. And then for energy, my kidneys,
Yes.
and then the mouth of we just did
Yes.
that.
Yes.
And
So
then
you have so many
on both
things.
hands because I have 2 kidneys. I was with her. I was like, yeah, okay.
That's right.
So funny. I know. So I have it written down.
Yes. So we have it for energy. We have it for running nose. We know for infection to build our immunity, right? We are building our immunity. Okay. What else? What else? Anybody has a question?
Yes.
Yes.
Whenever you do this, all the color or seed therapy, you do it for 1 week.
Yes. When you do it for 1 week, you will get better results.
Okay. Yeah.
Okay. Other things you can do when you feel that you're feeling, say, for example, you have been going through a lot of some function is going on, you have been being tired or a lot of things are going on. Then on that week, try to do either one. This one you can do every day. This one, the black one, you can do every day. The kidney beans you can do every day. This one you can do every day. So all of these, you don't need to do it all together. Whatever you remember, do it for at least 8 days. Right? So when you do it for 8 days, it's going to show you more and more results.
Yeah, I can tell.
Okay.
I was going through and I'm feeling better. So
good. Good. So a lot of people have insomnia and are not able to sleep well. Right? Insomnia.
Oh,
insomnia,
Insomnia.
and not able to sleep well. So one of the good things, or even if you feel like, you're not staying calm because something happened, some trauma is going on, then the best way is left thumb, under your left thumb, under the nails, white
White.
dot,
what color is that? White?
white. So white color is not easily available. So I got this pen, whiteout pen. So I use this. You can use whiteout, you can use white nail polish, anything.
Oh,
Because white color, it's
yeah.
not there. You don't find white
Okay,
color.
if you do white nail polish, then you have to, in the next day, you take it out and then do it again. Because if
Yes.
you do white nail polish, it will stay for, I don't know how many days.
Yes,
Depends on-
don't put it on your nails. It's right below the nails.
Yeah, below the nail.
Yeah, even the whiteout, it doesn't come out easily. So you will have to redo it. Redo it. Yes,
So you take it out and redo it again, like that.
Yes.
You okay?
yes, yes.
They have
This-
like those paint pens. Sometimes a paint pen might have a white one also.
Yes, yes,
And
if you can get it.
Yeah,
yes.
like sometimes those things.
Nowadays, the paint pens don't have white.
They
I
don't have white
looked.
anymore either.
No.
Oh, you remember that old liquid corrected stuff? I'm showing my age. You know, the whiteout?
Oh,
Yeah, that's
yeah.
what
The
that's what Smith is
Yeah,
saying.
that one.
That's
comes
what
out.
I said.
That-
Yeah,
Oh, the whiteout.
that's the one. Yes.
Can you use silver as part of it, as white or no? Can you use silver or no?
I would prefer white.
Okay,
Silver,
but
yeah,
silver.
silver is more grayish. You can use that too. It's fine. But white has worked good. You can
better.
definitely use silver. Yes.
Okay.
So there is another point called K1. So if someone actually faints, someone loses, like they start to become they're trying to become unconscious, there is a trauma or there is so much sadness, then you can, let me show you, there are colors, so I don't want you to get, okay. So your middle finger right here. And I'll tell you how to locate the point. So you go and point, you find the point at the tip of your nail, right? And then move that point here. This point.
Basically, it's behind that.
Behind that point, yes, right? So it's in the front, right?
Yeah.
Lot of times what has happened is people who start to, so when someone passes away or someone has real trauma that they cannot keep themselves together, this point, start to massage this point right away. If you don't have anything, massage it strongly around this point. Right away, do this white dot if you can. Do the white dot here. And press on the tip of the thumb here. Start pressing the tip of the thumb. You will see the difference. It has been done, and it has been, of course, I'm talking lot of things, I'm talking from what has been proven only, but some of the thing, most of the things right now, what I'm telling you is what I have experienced it with someone. So it does help. Okay.
So it's also the pressing the tip of the
thumb. Yes. You can right away put some seed or something point, like, a seed, whatever you find. And if you are outside in a jungle, just pick a small pebble and then put it here. Seriously, it is because a lot of times people would think like, oh, well, I was out there, I was hiking, I don't know what to do. Use anything, anything. The pressure point is important.
I know. That's a best CPR, huh?
Yes, it's a wonderful way to do it, and it has helped.
Can
So
that help like, can that help like anxiety
yes,
at the, so you
Yes.
like, you just tap the tip and then you rub the middle, right?
yes, yes.
Cool. And when I'm in a jungle, I'll make sure I remember to do that too. Right?
Yes.
So funny.
So there is another point, the same point that I'm showing you in this middle finger over here. The classical point for kidney is one is right here. So you take your little toe, and if you go diagonal, like, if you go and you find a groove here, if you start pressing around here, you will start feeling that the person is reviving, is feeling better.
Oh, that's for somebody else. When I'm in
Even
the
for
jungle.
yourself,
When
even
I'm in
for
the
yourself.
jungle.
But when you are actually fainting, you will not be remembering what you want to do. So tell someone to do this for you.
That is also for when somebody faints.
Yes, either fainting or, kind of passing out. They don't feel like, they feel like they are confused. They don't know what's going on with them. Even if you don't remember anything, the best thing is to start twisting. Twisting all your fingers. And the way you twist it with me. Hold it like this. See, my whole finger is moving, right? If I'm twisting, can you see it?
Yeah.
See? No, you don't even have to do anything. Only your finger has to twist. Right? Yeah, exactly. Just twist all the fingers. You will start seeing there is so much difference in the way you feel. So
Is this for dizziness? Is this for dizziness as well?
It can help dizziness. I will show you a point for dizziness. I'll show you a point for dizziness that you can note it. So whenever you feel dizzy.
Oh yeah, you showed me that.
Yeah.
Here. Travel sickness. Here.
Oh, yeah.
You feel travel sickness. Here. This is best. You feel travel sickness, start tapping here. Right here, right? So you can take this, hold right here where you're, we say in India, we say that the Panditji puts a pony here, right? Right there. Yes, Bronwyn, you had a question?
The twisting thing, like some fingers twist really nicely and others are kind of stuck.
And that is why you need circulation.
Okay, so this is a circulation.
Yeah. So if you feel that one of your fingers are tight, not twisting, or you feel pain, then definitely do that little bit more times so that you can see that the circulation is getting better.
That's interesting. Does this help with blood flow?
Yes.
What did you ask? With what? Blood?
Blood flow. Does it
Blood
help
flow.
with blood
Yeah,
flow?
blood flow. I see.
How many of you have this ring, Sujok ring? How many of you have the Sujok ring? Make sure you're using that Sujok ring every day. So one of your fingers is not twisting. Yes, good, good. If one of your fingers is not twisting, make sure on that finger you use this more often.
So it moves more often. I mean,
yes. So you can use this ring to make sure that the circulation is good. Then you try that finger again. See how easily the finger moves then. Right? Yeah.
Sometimes it hurts.
And if it hurts, you have to take care of it.
My both thumbs. Oh, it really hurts here.
Okay. So I'll show you what you can do.
And right here too?
Oh, yeah.
You said like right there? Yeah.
Yeah.
So this is one of the best areas to drain your lymph
nodes.
nodes.
Really? Okay.
So if you have a broken ring,
I have it. I'll show you.
so if you have a broken ring, and if you don't have a broken ring, just take a pen or something, massage this whole area over here.
Have this.
Yes. So you can take that broken ring and you can do it here.
Oh,
Remember,
yeah.
I tell people not to throw away. If the ring
Broken
breaks,
ring.
don't throw it away.
I
You can
kept
still
it
use
because
it.
you told me.
Yes, yes.
So you just do how, what time of the day? In the morning or any time of the day?
Anytime. Just
How-
make sure that immediately after your food, you should not do it, because immediately after having food, your body needs that rest to function on its own and not disturb the function.
You can use this.
Can you use anything like round? Can you use anything?
Round or
Round
anything
different.
that has edges. The edges will make a difference, right? If
Or
yes,
this, right?
yes.
Oh,
If you
wow.
have that, yes. If you have the Jimmy, you can use that.
And
Yes.
how long do you do it? Just for a few
2
minutes?
minutes, 5 minutes to 2 minutes, whichever it does. It's not like how
It's
long
not
you're
that for
doing
you.
it. See, you have, so I
Hmm.
have so many different things. So I'm just going to show you, like I have this roller, so I can do it with the roller. Okay. You can roll that anywhere. All these areas you can roll if you don't have a ring. Okay. Then I also have another one that I normally tell people, this is for the wrist and for, so I'm going to show you. So this helps to massage because the meridians actually passes from here, right? All the meridians that are passing, there are 6 meridians in the hands, 3 in the front, 3 in the back. Now, when you do this massage with this ring, what is going to happen? It's going
It's gonna pull out my hair. It's gonna pull out. It's gonna pull out my hair.
unless your hair is really big.
Yeah.
Yes. You're funny, brown man. Okay. Okay. What else? Now,
What,
I
we
have-
have this. How, do you use
Ow.
this on your feet?
yes, it's a very good tool. You can use that on your feet. If you use this 30 minutes every day or even 15 minutes every day, it's as good as walking couple miles.
Hmm.
But you should use it. You should make sure that your heel to your toe, your heel
Oh,
to your toe. You have to
okay.
be making sure that your heel and your toe, everything is being massaged.
Hmm. Got
Okay.
you.
Yeah.
Got you.
I have just a roller, just one.
What
Okay.
is that thing called? What is that thing called?
It's a foot roller.
A foot. It is a foot roller. Okay.
Mhm.
Thank you.
And there are different kinds of foot
the same
rollers.
thing?
Yes, yes. That is also
Yeah.
a roller, and you can use that also. You can use
Okay.
that. I'm going to show you 2 more things. One is for the ears, okay? And then
Yeah.
little bit of how you can do your reflexology. I'm already over my time. If you guys have any questions, I would rather answer your questions than just showing something.
મારે જો પેલું packing કરવાનું છે. હું કરી આવું? કશું કરવાનું છે.
Do you have any questions?
કાગળિયા.
Okay. Okay.
Yeah, for this one.
For years, I'll just, it's, yeah, I'm already up for my time. So what I'm going to tell you is ears. There are so many points in the ears, more than 200 points just in our ears, front and back, and it really helps to heal. Now, if you feel that you have to, say for example, if you press here, you feel a pain. You feel pain over here? Yeah.
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 Good.
Good.
If you don't feel pain, good. If you
Oh.
feel the pain, make
Ew.
sure that
Is it
you
at
are
the tip
massaging
or
it
inside?
properly, right? Because these are some of the important points. And I'll tell you how to take the point. You take your ears, hold it like this, bend it. See how your ears become pointed
Yeah.
over here? That point is where you're going to massage.
Mhm.
Hello, Ami. Someone just joined.
Look at
Do you
that.
feel the pain?
Yeah.
Mhm.
Yeah? You're feeling the pain?
Yeah.
If you're feeling the pain, make sure you do that every day. This will calm down
So
your whole system.
How long
It's
do
a
you do
very
it
good
for?
master point.
How long?
The best way for people I tell is like if you have any pain in your teeth or in your jaws around here, this part, the whole lobe, because if I teach you auricular therapy, it will take another 1 hour. But this part over here, the lobe, you massage the whole lobe, front and back. Massage it properly. You will find some pain points. When
And
you
that is
touch,
for
you will
what?
find some pain points.
That's for what?
Okay. So if you find some pain points, then massage it a little more.
Oh.
Okay. The groove over here,
Uh-huh.
right? The cartilage over here,
Yeah.
that is actually your spine.
Yeah.
So if you massage it on your spine, you're going to see that your back feels good after some time.
So from top
What
to
I suggest to most of my clients is that always when you're taking a shower, washing your face, massage the whole ear for 5 minutes. Take time to massage the whole ear because that is going to give your whole body a good massage,
so from
good
all the way from
circulation.
top to bottom, all this, right?
Okay. Any questions? The last thing I'm going to show you is reflexology. Okay. Okay. Ami, you joined just now. I don't know what all you have seen, but do you have any questions? I don't see you. If you can turn on your camera, that
No.
will be nice. Okay. So this is the foot. Okay, I'm going to show you quick tip to do some reflexology before you go to bed. Is really going to help you to get a good sleep also. Okay. Take some nice oil, whatever oil you like. You can take some oil. I suggest oil instead of lotion is because oil is easy and it'll move more smoothly when you are massaging your foot, because the lotion you will have to keep on taking it as you massage. So massage your whole foot once with the oil. Once you have massaged the tips of the toes, massage over the tips of the toes, massage the whole toes. So you're massaging, right? You're massaging the toes, okay? And then make sure you're massaging the whole body because this is as good as the body, okay? So when you massage, make sure you massage from here to here. Make sure you massage from here to here. Make sure you massage here. This is just a quick reflexology every day when you do. It's going to help you sleep better. Try this and give me feedback if you guys try this. Definitely give me some feedback so that I know how much it's working. I know when I work on you, it works. I want to know when you're doing it yourself, how much it works.
How long do you have to do this? The massage just for 5 minutes?
5 minutes is fine.
Oh, and
Yes,
both the
just
feet?
before sleeping, both the legs. Everything is on both sides because your body goes like this and then it turns into one, right? So everything should be done both sides.
Okay.
Okay. Okay, guys, I'm hoping you have so many different ways of treating yourself in different things. You know, your headaches. If you know your body, how the body is corresponding to the hand, then you know where you can work. If you have a headache, you're going to work here, right? Because this is your head. This is the back of the head. This is your neck. This is your throat. This is the back of the neck, right? So if you keep going like this, you will start finding your body, and you will start finding that you are able to get your body feel better, right? The best way is use the sujok rings, use the jimmy, use the rollers. Yes, you can use the rollers even in your hands like this. If you
Yeah.
don't have a roller, just take a pen. You know, you can take a pen and you can just roll it like this with the pencil, because pencil has edges. Do that. It's going to give you a massage, right? There are different ways of treating yourself. The best way is doing a small positive thought every day. Make an affirmation that everything is fine. Thank the universe. Say sorry to the universe. Ask for forgiveness and show the gratitude. It's always going to come back with a smile to you. Okay. So if you guys don't have any questions, we'll do a last thing is breathing. I don't end any of my session without breathing techniques, right? So let's all do a little bit of breathing.
Yeah, ekdam niche on the right side.
Breathe in, breathe out. So you do a slow breathing, breathe in. 1, 2, 3, 4. Slowly start to breathe out. 1, 2, 3, 4, 5. Relax. Again, breathe in. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4, 5. Breathe in. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4, 5. Relax yourself. Take a deep breath and release in one breath from your mouth like a whistle. Breathe in, deep breath. Breathe out with one breath like a whistle. Great. Hope you all enjoyed and learned a little bit about the alternate healing. And if you have any suggestions, any feedback after you work on it, please do let me know. Please do put it on Facebook or just text me so I know how it is helping you and what you guys would like me to come up with a new topic or new ways of teaching you all to stay healthy. I do have meditation classes. You can join my meditation class. It's always 6 to 7 in the morning, and they are monthly. So monthly $40, and you can join Monday through Friday. Okay.
It's every morning,
Every morning, 6 to 7, Monday through Friday.
Monday
Yes.
through Friday.
I have a
Yes.
question. What did you say about this one? For what?
This one is for acidity,
Oh,
acid reflux. Yes. Acid reflux. If you don't put a green color, you put a mutter seed, like a dried peas or any big seed, you can do that, and you can put that over here. it should help your acid reflux.
Okay.
Okay. Yes. Any question?
Do you tape those classes? Like if I missed it, or I just go the next day?
You can come the next day. That is what we start. The way we start the meditation classes, we start with a positive thought, first 10 minutes, then we do some stretches, and then we do the Om meditation, and then we go into meditation. And I tell people that it'll take some time for you to get used to it. So try a couple months and see how you feel. And I have been having good people starting to join because it's helping. Because I feel when you start your day good with a positive thought, it always helps. So I always ask people if anybody has a positive thought, positive story to share, we just share that. We go with some homework and then we all enjoy it.
Oh,
It's an
sweet.
interactive
Is
meditation
it
class.
once a week?
No,
is it-
it's Monday through Friday. Monday through Friday, 6 to 7, early morning.
AM.
Yes, 6 to 7. and
AM. AM. In
AM.
the morning.
Yes, AM
'Cause
in the
sometimes
morning.
I might be sleeping still.
I know. And I have got that same feedback, and I told them, and it's very surprising. Everybody who has now in the third session, like in the third month, I find themselves joining before me. So they are waiting for me actually now. So that's an awesome thing. That's
That's
wonderful. So
So thank
Um,
you so much.
thank you so much for joining, everybody. Hope you
Thank
all
you.
enjoyed. Take
Thank
care.
you very much. Very good.
Thank you.
Very
Thanks.
nice.
Thank you. Thank you. Take
Yeah.
care. Bye.
Thank you.
Bye.
Take care.
Everybody.
Bye.
Bye. Bye. Stay blessed. Stay warm. Stay safe.
Yes, thank you.
And get your COVID shots.
Yeah.
Yes.